Times.
Okay, well, this is the first time it's going to be recorded and put on YouTube, probably though. So,
Good job.
thank you. All right, folks. That's 11:03. We've got let's see, 45 folks that have joined us thus far, and we're going to get going here. My name is John Decker. I'm the Director of Community Services here at Alta California Regional Center. We'll introduce some regional center staff that we have here. And so I see Nicole. Good morning, Nicole. And I see Heather. Good morning, Heather. And Hewitt, our emergency coordinator. Hello, Hewitt. Good morning. And my assistant, Zach, is here. And Kate, another one of our specialists. Good morning, Kate. And Olivia, one of our community services managers that is here. And let's see, like I said, it's 11:03, so we'll get going. And I guess we can start, might as well start with introducing Gary, since he just found out that he's going to be asked to speak to this large public meeting that's being recorded right after he joined our regional center.
Yes, so I would love everyone to welcome Gary Castro Cutts. He is joining us. He was a service coordinator at Kern Regional Center and is joining our Alta as our employment and day program. We got a growth position, so we are very excited to have a new specialist. He's going to be taking over some of the supported employment and some day programs. So stay tuned he'll be reaching out to the programs that he's assigned to, but we are super excited to have Gary here. He comes with a lot of knowledge and has great energy. So we're just happy to have him as part of our team.
Absolutely. Thank you. Welcome, Gary. And you know, a lot of the service providers that you're going to end up working with log into these meetings on Fridays to kind of get updates on things that are going on. So we'll jump into your agenda item a little bit later, but wanted to make sure folks knew who you were, the newest member of our team. And some folks might remember, I don't know, about 6 months ago or so, we talked about with all the changes that were going on and also just what we're hearing from service providers about what they foresee as being the future of like employment services and day services. We felt our regional center needed to hire on more support so that we could support you service providers. And so it's certainly taken a little while, but we got the position filled, and we know everyone's having challenges filling positions. And obviously we are happy to have a person that has regional center experience coming into this role as well. And so Gary might even be able to see some of his coworkers for the first time on this that he may not have had meetings with yet. So some folks might be truly being introduced to Gary for the first time. So for today's agenda, some of the things that we're going to talk about is some of the stuff in the news about the mask mandates. We're going to have a social recreation discussion, maybe a little bit about camp as well. Briefly discuss the assembly budget hearings. Livia's going to give us all things minimum wage increases. And let's see, we're going to talk a little bit about health and safety waivers, upcoming transportation vendor forum, electronic visit verification, and the other DDS upcoming meetings. I believe we have SLS scheduled for Monday at DDS for the rate study discussion. We're going to talk about, I think I saw Michelle Ramirez log, or I saw a Michelle Ramirez log on. I don't know if it was Michelle Ramirez from CBEM or Michelle Ramirez from On My Own. I don't think that we will make Michelle Ramirez from CBEM talk about the PAC letter that was discussed during the Provider Advisory Committee, but we might make Michelle Ramirez from On My Own, who just let me know that she is here. So thank you, Michelle. We'll get there in a little bit. And then we want to talk about the workforce survey that was discussed as well by DDS amongst our service providers yesterday. And then also there's a couple upcoming opportunities, one that Gary's going to talk about, and another one that I believe I have the link for, which is another training opportunity. So, and I obviously, as always, you know, in the chat, if there's specific things that you guys want to discuss, you know, please don't hesitate to let us know. So I guess first and foremost in many of our minds is the fact that, you know, we are starting to see the Omicron surge go back down as we have experienced with many of the previous surges as well. I will also say good morning to Heidi, our manager in our Grass Valley office. Always good to see Heidi. So with that, I will just tell you, I am every day looking at where we're at as far as case counts and everything else, and we certainly have seen a precipitous drop, just like we saw a huge increase. And there's been some interesting modeling that's been done by the department to take a look at, just like, for example, how many special incident reports have come in and things like that. And I will just tell you, there is nothing in at least the last 11 years that has gotten close to approaching what we've dealt with related to the Omicron surge. I mean, every natural disaster we've gone through, relocating people, we have never dealt with the volume of special incident reports that have been coming through. And Jordan Eller, you guys have been able to meet her. She's the new manager that's overseeing risk management. So she's overseeing special incident reports. And I'm not joking, Heather, we had like every member of her staff that were processing SIRs. Zach was processing everyone was processing SIRs. We had our deflection specialists, our community services specialists, everyone, because there was just such a volume coming in, and they're still coming in because we're still, learning about them. And I know, we started off the week with some higher reports to DDS about numbers of COVID cases per day. I think we're down to about 20 or so per day now. But bear in mind, in the entire month of December, we only had like 30. So the fact that we're still having days where we're reporting 20 in a day lets you know just how many people are testing positive. That being said, we continue to see what we have been seeing, which is that though we have a huge influx of new cases, the hospitalizations have not even been where they were a year ago. So last January, we had more hospitalizations and about a third the number of cases. Well, about a half to a third the number of cases that we're seeing right now. So again, I think that speaks a lot to the efforts made by many of you service providers that have assisted in getting clients vaccinated and have, continued to maintain all the safety measures that, have been required and constantly changing throughout this time frame. So again, that's kind of where we're at with it. In that vein, we have heard that I believe most of our the counties in our area, we're looking at the mask mandate being repealed when the state, has it as well. If the case rates continue to drop, I know we heard from Sacramento County and some of the other ones that they are going to look at dropping the mask mandate as well. So again, some things to look forward to next week. For many of you, it's not going to look any different because you run the types of services that are still required to have mandates. And so if you obviously run licensed facilities, you've got licensing that's providing you regular updates related to what your requirements are. And if ever you have a challenge understanding exactly what your requirements are, you can always reach out to, if you're a licensed facility, to your licensing program analyst. You can certainly reach out to your facility liaison. And if you're an unlicensed facility, you can always reach out to your community services specialist. And as we tell you, because again, we have people that log into this meeting that aren't always like the owners of businesses or whatever else, but if I could have a staff drop Christine's email in the chat, please. And if you are not sure who your community services specialist is, please do not hesitate to reach out to your assigned community services specialist, to Christine, and she can let you know who your assigned community services specialist is. Alrighty, and let's see here. And we have a few more Alta staff that have joined. So I know Jordan was in and out and back again in this meeting. Here she is, Jordan Eller. And Carol is here as well. Good morning, Carol. And Dana is here. So we've got some of our client services managers that have logged in for this morning as well. And thank you, Zach, for putting that in the chat there. That's Christine's contact information if any of you are unsure who your community services specialist is. And some of you will be assigned to Gary at some point, but we're just kind of getting him on the into the flow of things right now. And so Olivia will work on all of her assignments, I'm sure. So what I wanted to discuss briefly was some of the ongoing the ongoing things that are being said related to social recreation and the return to social recreation. So Carol has certainly been a manager at our regional center since social recreation went away. And I know I joined Alta right after it went away, and I have heard nothing but people wanting it to come back from the very beginning. And the loudest voices, or many of them that I've heard, have come from the regional center themselves, saying, like, this is all we hear from clients and families is wanting these these repealed services to come back. And so we're all really happy that that's the point where we're at right now. But it is a challenge when you have like 14 years that have passed, or whatever it's been, 13 years that has passed since these ones went away. Because again, like we don't have it. First off, we have staff turnover that has led to service coordinators that really don't know what like authorizing or assessing those services really look like. Like they just don't have experience doing a lot of that because it's not something that they have. And then we as a regional center, a lot of those vendorizations went away. And so I want to clearly describe what we're doing now to make sure that you as our service provider community are aware of it. And then I talked last time about like the types of things that should be included in a like a PowerPoint presentation about like, if you are going to want to do social recreation with the regional center, here is what it's going to look like. Here's how you can get paid by the regional center. And this would be something that would be for people that might not already know what the regional center is. It might be Granite Bay Karate. Well, Granite Bay Karate should know who we are because even though it's been quite some time since we paid for it, but some of these other ones. And so one thing I will say is that if any of you feel like I really want to help Alta California Regional Center develop a very clear one-page slide of what the vendorization might look like for social recreation. I love doing these things, but I don't like doing them by myself because I feel like I'm not the intended audience, and you guys have a little bit more of a handle on what the intended audience would be of someone that might want to get into business with us. And so that being said, if anyone is interested in possibly helping me on this in the next like 2 weeks or so, and would be willing to do like maybe a half-hour meeting with me or an hour meeting with me, or at least maybe I can send my draft information over to you so you can take a look at it and give us feedback, I would appreciate that. And so if you're interested in doing that, shoot an email over to me, and I will be very happy to utilize you to give me feedback and support on this. Because again, we want to put a product out there that makes it really clear that social recreation is back in business, and here's how you can get in that business with the regional center. So to explain really quickly so that you are all aware of what our current practice is, which I don't know that we've actually talked about it that much in here. Right now, the reality is you guys know we're dealing with the ongoing pandemic, and the contacts that our service coordinators are making with clients, I'll be honest with you, are not like checking in to see what's going on with social recreation. It's like health and safety type contacts, like those calls that are being made and the follow-up and stuff. However, since these repealed services have come back, we've had a number of IPPs, and in those IPPs, service coordinators are finding out what clients and family members have been paying for. And what's going on is we are now bringing those requests to our best practices committee. And so the best practices committee, again, is a group of our directors. It possibly could be clinical staff, community services staff. And really it's talking about like, in essence, is this an appropriate recommendation and how can we quickly get it funded? And so what we will do is take a look at, like, for example, the supporting documents, what it's for. And then the idea being, we want to give the family and the client like an immediate response. So what we're trying is we are doing a purchase reimbursement for the initial, like for what has been paid in essence right now. And then we are doing a vendor request from the service coordinator to our community services department to vendor the service, if that makes sense. So we can fund the immediate, like whatever that immediate cost is. And again, we're doing those through the purchase reimbursements, which is 024. And then for people that want to, and then, if we're going to look at long-term funding, then, we're having our service coordinators assigned to it to work on getting that vendored. And so maybe we can talk about specifics, because so it kind of makes a little bit more sense. So let's say you have an aide, for example, that has been supporting someone to participate in the social recreation program, and it's something that the family's been paying out of pocket for. And that aid may be something that, we would be willing to fund possibly, to help that individual be able to participate more fully in those activities. Well, then, if they've been paying, we can certainly do a reimbursement for the cost that they've paid for that. And then what we would do is we would run it through vendorization to see if they are willing to get into a vendorization with us so that we might possibly do a usual and customary rate. So for example, let's say it's a, I don't know, let's say it's a swimming class or something like that, and they have aides that support people that have physical disabilities or some type of additional assistance that might be needed. Well, if they provide that assistance for our folks, for people with developmental disabilities, we might look at funding it at that usual and customary rate that they typically would charge for people that have aids and things. Again, there's a lot of ways that regional centers are trying to figure this out right now. I was emailing Nicole, right? Was I emailing you about this yesterday? I think Nicole Smith about the FMS. No, you're shaking your head, but the answer is yes, isn't it? It is. Yes, it was. So that being said, that the other thing that's come up is people are saying, how can we utilize FMSs in this process possibly as well? And I will just say the regional center is looking at all of those things, but really we're kind of looking at two, as to social recreation, two things as it relates to outreach. One is kind of public entities and private entities. Public entities being like those city recreation and parks departments, and the private entities being, you know, Granite Bay Karate, that type of thing. So with that being said, I appreciate, you know, anyone that is interested in being a little sounding board as it relates to that. I don't know I know that the camp RFP is expected to come out in February. I would assume that it's going to be coming out in the next couple weeks. And one thing that we're going to have to be really clear with, you know, those applicants that are interested in doing a camp, you know, kind of from the beginning, is that, you know, we're going to be opening it up statewide, and the time frames are going to be a little bit tough, because we're going to have planning teams in the months of like March and April that are going to want to get summer camp stuff figured out, and I don't know what we will have available between now and then. That being said, one thing that the regional centers have all agreed on is that we are, as soon as camps become available, we are going to put them in a central repository. We all the community services directors have our own shared drive that we can all access. And so we're going to put all the camp information right in there so that we can immediately get the vendor information from one regional center to another. And then as soon as we find out about it, I'll be emailing these client services managers, and we'll be making sure that our service coordinators are aware of the different camps that become available. As it relates to like social rec and non-medical therapies, one of the things that we talked about was in places where our catchment, this is not as much Southern California, but a Northern California thing. Southern California, their catchment areas kind of are all a little bit jumbled together. Within but for us, we've got, you know, many rural areas that exist between Sacramento County and like VMRC's area, for example, or Yolo County and Solano County. And so one of the things that we discussed is where we share these meeting up of boundaries, if there is a social recreation resource like in that area, we're going to share it with whatever regional center is like nearest by, if that makes sense. Because what we're finding out is like our families are private paying for like hippotherapy in Dixon, I think, which is obviously in Solano County, not one of our 10 counties. And luckily we knew North Bay was already working on vendoring that, and we were able to kind of work on that request. So again, we are plowing forward as fast as I think we possibly can. It seems like we're staffing like at least a couple of these a week now at our best practices every Monday. And just, I would say, stay tuned. We are still awaiting the approval of our social recreation policy by DDS. I believe all the regional centers was what I heard last. And so, again, just recognizing we've got, you know, service coordinators that aren't used to, you know, the assessments that are necessarily related to social recreation. We've got community services specialists that have not been involved with vendorizations of social recreation services. And again, we're just trying to do our best to get it kind of going as quickly as possible. And we have a raised hand. Eric, yes.
When it comes to something like the social service standards for rec and just implementation plans, I know the regional centers are submitting theirs to DDS, but are the regional centers coordinating on those standards and those plans to make this service somewhat uniform across the state? Is there any collaboration that's being done to do that?
No. Oh, that was on video too. Sorry. No, what I will
Okay.
say is, did all the regional centers get together to to align their plans before they were sent to DDS? No. That being said, as my staff would have seen from some emails that I sent to them yesterday, the community services directors are talking every single day about this. Like, and sometimes like there's 4 or 5 emails throughout the day that are going on related to this because everyone's trying to figure it out right now. And so I know, for example, on Thursday of next week, we have our community services directors meeting, and we're going to be talking about it again. And so the coordination aspect of it, have already started talking about. So, for example, making sure that we've got the camp information in one location, making sure for social rec that we've got, shared boundaries where we have the information sharing amongst the regional centers. But absolutely, I think when we're talking about how we're going to pay for these things, one thing we did get from DDS this week is a subcode. We have the subcode that is what is it? SRA is what we learned, I think, and we're going to be adding that subcode so that they can track the purchases. So one thing is when we're doing the 024 purchase reimbursements, now we'll have a way of tracking how many the regional center are actually doing. And again, I think that's good information for us. That's information that we can share with you all too, because I think I will say, I know that there's a sentiment out there amongst advocacy groups that the regional centers are either putting up roadblocks or not implementing this as fast as they possibly can. And so I think us being able to show you the numbers that we're actually staffing, the number of requests that we're getting in, the number of purchase reimbursements that we're working on, like those are things that I think pretty solidly show that the regional center is working on it quite a bit. And I will say good morning to Tracy as well, one of our associate client services directors, who does have the pleasure of sitting in our best practice committee and staffing the social recreational ones that come in. So she would also definitely say that we have definitely dedicated a lot of our executive type time to it because we want to ensure that we're providing the best support for our service coordinators, who many of them are new again to these services. Eric, I see your hand is still up. I don't know if you still have a question or if.
You.
Yeah, go ahead.
Just real quickly, I would say it'll be interesting to see how this rolls out because, and I'm sure other folks know more about social work and camp than I do. But I suspect there'll be social rec and camp seems like something that regional centers could interpret differently about what types of services are fundable under the social rec and camp and how it's funded. And so it seems to me there could be a lot of variation for this service. And it's also a service that then potentially pretty easily would cross over regional center catchment areas because, if you're going, as opposed to say your home, which is probably where a lot of services are required, you might travel 30 minutes to go to that dance class or to go, certainly for camps, right? Which it would be your main regional center, but it'll be interesting to see as then people at this camp are from 3 different regional centers and maybe people are doing it differently. So it's just something that I see potentially a lot of variation in, and I'm just wondering where that goes. So, but I will also say, I'm sure you guys are working hard on it. I'm not one of those people. I just am wondering where it goes from here. Thanks.
I think that's, sorry, go ahead, Tracy. Yeah.
I was going to say we're in the same boat. We are wondering too, but I will tell you, I was here pre-2009. I was here for 10 years prior to 2009 when it ended. And so I was here during the social rec days as a service coordinator. And you are right. Camps were ones that overlapped regional center to regional center. And we worked it out really well. It was a good opportunity for a lot of our clients. And so we hope to get back to that point. And I don't know if John shared with you, but we've created a PowerPoint. We've started training our staff. We've got, I've got a list of FAQs that we put together from that. Well, I don't know if I want to call it a training because it's still kind of an informative, informational session, but that service coordinators have. And then even after that, I asked them to continue to send me questions because in scenarios, I've gotten a lot of scenarios as far as like, what if a parent's asking for this? And what if a parent's asking for that? And that's been really helpful because it gives us the opportunity to then say, we're getting the same type of questions for the same type of scenarios. And so we really need to look at this and we really need to address this. So we're meeting on Monday to kind of go over all of these questions. And so it's just, you know, keep the questions coming. We will let you know what we find out, you know, from the FAQs will most likely be public so that everybody will have an option to review them as well. And it'll kind of help streamline some of those planning team meetings.
Yeah, thank you very much, Tracy. One thing I guess I would ask this group is, you know, would you be interested in getting a brief informational session on social rec and hearing what our service coordinators learned about it? Like, I don't know if that's something that would interest folks here, but if that is something that would be interesting to you, why don't you put in the chat just a yes, if that's something that you might be interested in having we probably talk about it as long as we've talked about it so far today, so less than half an hour or so. But just giving a kind of an overview and at least so it appears I don't need to do any more convincing because I see 50 yeses on the side there. So let's think about that, Tracy, as we move forward, and maybe we can do a kind of if Michelle Ramirez is being honest and she's going to really help me with this presentation, maybe we can share that one pager that I put together with Michelle's help, and then we can also share the materials that Tracy, that you guys used previously for the training, because I think that information is really well put together, the stuff that already existed. I will say that there is a collaborative between the ARC and ARCA related to all of this through the ARC's UCP collaborative thing group with ARCA as well. And so there's a lot of energy about it. One thing I want to say though too, and going back to Brianne's question about the rates and stuff like that, that's another thing that we're looking at is like, how can we find rates to support this? Because like some of these rates are like old 1 to 10 rates that are like poor rates. And so and then many of you, if you did behavioral services, know that in 2011 or so, 2011, 2012, right around 2011, we had service standards that went out about social skills, because we took service code 028 and turned it only into like a kind of a group social skills behavioral service, which we might have to revisit that because other regional centers are vendoring new social recreation programs under that. So for us, it's really going to be looking at, what rates can we use that are going to be able to support these programs if it's not something that is going to be a usual and customary rate. So again, if it's going to be, someone that is only providing social recreation services for people with developmental disabilities, and it's not something that, and they want that direct vendorization with us, then we've got to find the correct service code to be able to find a rate that will work for it. Okay, so we know that might be something, we know that is something that folks have asked for, and so we can look at doing that in one of our upcoming meetings. All right, cool. Well, that was my third agenda item, and we're half an hour in. Perfect. Only got 10 more agenda items. All right, so I am going to apologize. I could have sworn a few weeks ago I said that I would share with this group when the upcoming budget hearings are, and I did not send out to this group the budget hearing that was this week, and I will blame that on the fact that I was delivering test kits all around our catchment area. I had the pleasure of going to Woodland on Monday, and we did a distribution for Yolo County providers with COVID-19 test kits, and that went to all the licensed care homes in Yolo County, and like the retirement facilities, all of them came over to our Woodland office. And then on Tuesday, I drove up to our Yuba City office, and we did a delivery, or we did a handout out there for our Yuba and Sutter County residential providers. And right now, downstairs on our first floor is is community care licensing, because starting tomorrow at 8 a.m., there's going to be a huge test kit giveaway in front of Alta, right? And just like we did with the PPE and other stuff in the past, they are going to be doing, I think, facilities with more than 200 residents between 8 and 10. And then from 10 to 3, it's going to be like the 4-bed, 6-bed and smaller facilities. So that's going to be tomorrow. And again, this is a big push from the state of California to get these test kits out, because we want to ensure that folks have the ability to, that folks have the ability to be able to have visitors come to their facilities. One of the questions, do you have to register for the PPE giveaway? There was an email that came out a little bit earlier from Department of Social Services related to it, and it just said you need to show up. This is for all licensees. So if you have a licensed facility and you live in Sacramento County, then, and this is not a licensed day program, this is only licensed residential facilities, then you can swing by and let them know that bring a copy of your license when you show up, and then they will give you a bag full of test kits. Service providers are getting 3 test kits per resident. So everyone gets 12 if you've got a 4-bed facility with 1 resident per room. So with that being said, the assembly budget hearing, it was the first, there's going to be quite a few more hearings before we get to a final, budget and something solid in the summer. But I would say the benefit in attending these assembly hearings is that you get to hear a little bit more from DDS about what their ideas are about some of the policy measures that they have placed into the budget. And so if you have an opportunity, you can go back onto the Assembly's website and you can, I believe, listen to recordings. And certainly we will try to do a better job of getting the information out there in advance of when the budget hearings are. I think I'm just thinking of back in the day, and certainly Eric and Michelle and others were right there with me in many of those budget hearings, and those ones that would go to like 6 or 7 o'clock at night as well, the DDS budget hearings. So again, hopefully we end up with some solidified budget measures. And I guess and I don't know if Eric or Michelle or others want to share this, but the tone amongst many during that meeting was an acceleration of the rate study, an acceleration of the rate study, an acceleration of the rate study. I will tell you, I wasn't exactly sure about the language and the numbers that were used, because I was not sure if the request was for the rate study to be fully implemented as of April. But then I guess yesterday in our provider advisory committee, we talked about it a little bit more, and it seemed like the request was rather that the portions that maybe would have come next year instead of this year come this year. So I would open it up, because I want to be able to share about the letter that our provider advisory committee is planning on sending, because we have significantly more folks here than typically attend. We have 70 folks here, which is a lot more than attend our PAC meeting. So Eric or Michelle, would one of you be willing to unmute and just explain to this larger group kind of what the ask is that you guys are looking at doing with that letter?
Yeah, but I'll pass it off to Eric. But before we start on that, can I just give a shout out to our executive director, Lori, who presented at the hearing. And I just want to say that I've been going to those hearings for 17 years now, and only a few executive directors in our state actually show up and testify, and our director did. So it's just nice to know that she is willing to go through that uncomfortable. It's intimidating, if you've ever gone there to speak, and she did a great job. So I just wanted to say that, and then I'll let Eric talk about our letter. So.
Sure. Yeah, I totally agree with Michelle. And it's always great to see more folks participating in hearings and raising up new leaders, and glad to see Lori stepping into that role. So if you're following what's going on there, so there's really 2 pieces of this. First is what's happening outside of the PAC, your local PAC here, what our advocacy groups are doing. This has come up pretty quickly. Many advocacy groups are proposing, as part of their legislative asks or agenda this year, that the legislature accelerate, my term, but other folks use a different term, the funding of the rate study. Some folks, from what I understand, aren't asking for the full amount right now. So maybe funding to 50% versus 25%. Other folks are asking for 100% funding of the rate study this next fiscal year. As we move forward, I think some of these proposals are slightly different in what they're asking, but the general ask is the same: fund it now, fund the rate study now with the $29 billion surplus the state has, unexpected surplus. This would not be a significant part of that surplus. So we wanted to fund that now. Plus, the legislature has already committed to funding the rate study. This isn't a new expenditure. It's just that they were going to delay it and do it in increments over a 5-year period. we're saying just do it now, just fund it now, and you're done. You've already committed to expending those funds from the rate study now. So there's variations of that between CDSA, the UCP and ARC collaboration, the Lanterman Act, or the Lanterman Coalition, and other folks that are presenting. Prior to seeing their presentations, your local PAC discussed this, and we came to the same conclusion that other folks would come to, which is with the historic state surplus, we wanted to put our hat in the ring. It's always difficult as your PAC to figure out what leverage we have, what options we have, besides yelling into the void. What could we do? So this letter is written to the chairs of the subcommittees that will oversee this. And then we also early on decided to send this to the 21 chairs of the other regional center PACs. So the idea was, that's our community. We don't coordinate much at all between all the regional center PACs, but we could do that and maybe prompt all those 21 groups that are similar to ours to take similar action and see what we've done and try to get as much movement there. We also are planning on sending this to our representatives in the legislature that represent our service counties, and we keep adding to people that may get this letter. I will briefly share it with you. I'm not going to read it. I don't think we have time to go through that, and I don't want to take your time. So I'll just share the basics of this. Here is the letter that we are planning to send to the legislature. This has a quick preamble about what somebody is no, you cannot annotate my document, Samantha. But anyways, key here is that we are experiencing the biggest challenge right now facing us is the worker shortage. It is it's an immediate threat to the system, not just right now, but in the years to come. If we don't rebound now, the economy will leave us behind. Our workers will move on. Our workforce will be depleted. It will take years to come back. So what we're asking is to use a portion of the historic surplus to fund the rate study. And then we have our specific ask, more specifically, is to fund the rate study. I guess I'll make the distinction. What we're asking is for money, not methodology. So give us the funding now, and then take the next year, or as long as the state needs, to do the other work related to implementing other parts of the rate study, like changing rate methodologies or amending rate tables for services like ILS that have big issues with, or changing statutes to allow certain services. So the idea is you can fund now and then implement all the methodologies as you need to down the road. We are committing as providers that we will raise our rates then to at least the minimum rate. So the state does not want to give us money and then not know with a guarantee that we're going to raise wages. So the idea is you give us that money, you can hold us accountable for raising our wages to the applicable rate in the rate study or higher. So that we stand ready to meet that commitment. We want bilingual pay because that's part of a wage differential. We want them to work with leaders to update rate studies. There are flaws in the rate study, so we don't want the legislature to think that we are ready to accept the whole rate study as is. And our letter included requesting DDS to continue to get staffing data from the whole workforce and keep getting that from providers. How many people you're employed, how many part-time, full-time folks, those types of things, just so the state can monitor the workforce, because they're not doing it so that they can claim ignorance. There's quite a lot here that then details for those that want to know how we got here. Again, I'm not going to go through all of this, but the premise of this is that our workers have been treated as cheap labor for way too long. You can't have quality services without quality workers. You can't meet any of your goals without a workforce. So fund competitive wages for our staff. There is no way to rebound from this great resignation without competitive wages. Fund competitive wages, fund the rate study, implement everything else over the next period of time that's already outlined in statute, and we'll go forward from there. Michelle and I would sign this. We have PAC members, but I just haven't added them in. I got to go through all of our minute notice. We're going to be adding members' names here as a co-signer on that letter as well. So that's something your PAC is doing, trying to do our part to move the ball forward on at least this part of the legislative agenda this year. John, back to you.
I just want to see if anyone has any questions about that, because I would tell you I was not aware that the letter was going to be coming out, and any time that you guys can get together and put something down in writing and really try to represent not just the provider advisory committee, but obviously every provider that we have, you know, and be able to, again, put it so succinctly in writing as well is certainly something that I think is beneficial. One of the questions that I have, Eric, is that there certainly might be folks here that are very interested in this and being able to see kind of the final version. And so maybe let's be prepared to figure out how we want to share the final version with a larger, kind of with our larger provider group. I don't necessarily know that we would be sending it out via our MailChimp service to everyone from Alta. But that being said, we certainly can maybe have a discussion and hear about it. And we know that it's going to come up in the provider advisory committee moving forward as well. And so let's see, I'm just going to look in the chat real quick, see if there's anything not in the chat.
We didn't talk about this at the PAC. We didn't talk about this in the PAC, but I was going, and I haven't even talked to this with Michelle, but I thought of the same thing, that this does need to be sent out, but it should live somewhere. And so I was going to ask also to consider adding this for at least this budget season to the PAC portion of the website. No one's going to find it unless they go looking for it, but then we have a link that then we can send out and other folks could find. It doesn't help us right now, except for I could tell folks if they wanted to look in the next day or two, go to the PAC website. Hopefully there would be a link there. So if you are interested in finding the final version, I can at least give them that general access, or you can email me or John or somebody will give it to you if it's that important. But that was going to be my recommendation.
Yeah, I think that's always the best, is we can, you know, come here, drop a link in the chat, and then if people want to, you know, pull that information that way, they certainly can. But thank you for that. All right. Let's see here. Olivia, minimum wage.
Sure. I just wanted to give everyone a reminder that if you have minimum wage increase requests, they are due to the department or the regional center by March 1st. And the ones that are going to come to the regional center are negotiated rates, and the ones that go straight to DDS are for rates that are set by DDS. All the information is on our website, and the spreadsheets are there and everything. So just kind of wanted to remind everybody, because March 1st is going to be here before we know it. So, and John is showing you exactly where it is. You can just type in minimum wage.
All right. As always, I think we have a pretty good search function here, as long as you can spell things like minimum wage. There we go. Minimum wage increase. Effective January 1st, 2022. Here's the instructions for service providers with a DDS set rate. Here's the instructions for service providers that have that negotiated rate. And if you're really having questions about this, we talked to our purchase of service manager, Robin, a little bit earlier before this meeting. And she said, please don't hesitate to email minwage@altaregional.org with your questions. That's also where we want you to submit your completed spreadsheets. But she just wants to know that you can reach out directly to the accounting department if you're having issues or questions related to filling out the sheet. And I will just show you real quickly. We've included the link here to the sheet as well. And you can see it right here. So there's the explanation and the vendor worksheet, certification instructions, and then the vendor summary and certification. Has anyone done theirs already? Has anyone filled one in already and turned it in? No, everyone's shaking their heads. I was just curious. Oh, Andrea has. Hey, do you know about how long it took to do it for InAlliance? I'm just curious.
It was a group effort, so it took a little longer than probably necessary, but it doesn't take that long. It's just some payroll records and billing records, so it's pretty easy.
Yeah, we did ours too on my own. So we had a formula for every year, so it's pretty easy.
I like hearing pretty easy. That's good feedback right there. Alrighty, and let's see. So that's what we have for minimum wage for folks. I forgot to mention one other thing that occurred during the Provider Advisory Committee meeting, and I think that it's something that's been a big topic of conversation here. You just heard Eric mention it as a component of the letter that is being submitted by the Provider Advisory Committee, which is workforce challenges. And so there was a presentation by Leslie Morrison, who's the chief over quality assurance and is doing a lot of stuff with data at DDS, specifically about them putting a workforce survey for DSPs out. And I believe, and I did come a little bit late to it, that it was going to be springtime when DDS was looking at putting out this survey for DSPs, and certainly looking for a lot of quantitative data. and it seems like it's going to be very thorough. So we will certainly let you all know when we hear that it's ready for release. We're going to encourage you all to fill it out, just like you filled out the survey, 6 months ago or so, related to your hiring challenges. Of course, that was before the mask mandates, or excuse me, the vaccination mandates and the booster mandates that we've run into since then, that have certainly impacted hiring and retention, as well as just in general the individuals leaving their jobs, which is certainly going on across every sector. Though when it's direct support professionals, it certainly has a huge cost to it. So I don't know if anyone else has anything about that workforce survey, but we'll be looking forward to that coming out in the springtime. I want to share a couple more things. Oh, sorry, go ahead. I heard someone and then I guess I didn't. So I also want to share from DDS's website some of the upcoming activities that are there. I think I already sent the SLS one to Carol for her to participate in, so she would understand what was going on with how they're planning on changing supported living rates. But again, this is DDS's website, and it was Michelle Ramirez that told us quite some time ago that if you scroll down, they've got the upcoming events calendar right there. And as I like to show folks, I like to be able to look at it, and you can go for a month at a time, and you can see in the month of February kind of what's upcoming. So we see February 14th, which is not just my son's birthday, but also an opportunity to hang out with DDS on Valentine's Day. So we have the rate study discussion with DDS. Please register in advance. It's from 2:30 to 3:30. The transportation one was last week. I think that they were clear about how they are planning on figuring out what the rates are. However, there is still a ton of confusion amongst folks, specifically about what they are terming bundled rates, in essence, rates that include possibly more than one service. So for example, both the actual transportation itself and the planning for the transportation and those types of things, like the other activities, and or for supported living, if we have one rate but we've got different levels of staff possibly. So that being said, as you could probably imagine, regional centers have had many different ways that they have vendored different supported living agencies, and some have kind of come in line, and we've certainly kind of at least over the last 11 years have kind of changed the way we structure things a little bit. And Carol's, I know, has been very helpful, especially with teaching me how to read SLS budgets for the first time. And I still feel I have like about 45 to 50% of the competency that I need to fully understand our own budget template, but we'll get there at some point. So that being said, I just want to encourage you all to attend these meetings, especially if you're a supported living provider. Again, finding out how the department is planning on changing the rates and doing the rate increases is going to be very helpful. Additionally, we have the Regional Center Measures Work Group and EVV self-registration office hours. I like this. Again, we've talked about the different work groups, and you can find out information about them by going on DDS's website and kind of clicking through the calendar here. But the the EVV self-registration office hours is kind of in line with that discussion that we had a couple weeks ago with Jennifer Parsons from DDS. If you're having challenges getting staff self-registered, DDS is holding evening office hours. So they get some daytime office hours from 3 to 4, but then they have a 5:30 to 6:30 as well related to self-registration. So I like this because I feel like they're trying to be responsive to all of you service providers that have a hard time taking off in the middle of the day to attend these trainings specifically related to this. So that will be available to you related to EVV. I did say that we were going to send out the YouTube video link to folks that attended the EVV meeting with Jennifer Parsons. And so we will send that out shortly. I just need to make sure that one got uploaded because we've been a little bit behind on our uploading. We're like 2 or 3 weeks behind on our uploading. So we'll get ourselves caught up on that. Let's see. We have a transportation vendor forum that is coming up on February 22nd. And that's going to be, I'm sure, tons of question and answers related to the ongoing rate study work. I think one thing, and I think I believe I mentioned it last week, was, you know, it sounded like DDS was hoping to get the end of these rate study worksheets in the next few weeks, the next couple weeks, possibly, back to finish the last bundles of, or the last, what are we calling them? Batches of rates, the last batches of rates. And so I know there's been some service providers that have said, well, I haven't heard from my regional center yet specifically about like my specific rate. Well, many of our rates, you know, we have all your rate information. We have your vendor file, we have everything else. But for those that certainly look like they're off or seem like there might be some issue, the direction for our specialists is to make sure that they reach out to our service providers and provide that information, get that clarification that's needed. So, all right, let's see. Gary, did you hang with us throughout our entire time? Look at that. There you are. All right. So I'm going to pull up, let's see if I can find. Uh-oh. I thought I could find it.
Yeah, for a second.
Did I? Did it pop up for a
Yeah,
second?
for
Oh, there it is. All right, perfect. All right, what do we got here?
Oh wait, it's not this one though.
It's not that
Oh,
one.
it's that.
Sorry, we're going to stop sharing real quick so that I can find my correct screen. And then we'll go from there. There it is. Okay. Share one more time.
All right. Good morning, everyone. Oh, sorry. Good morning, everyone. The Business Advisory Council has put together a virtual job fair for a bunch of our providers. It's going to be February 23rd, 12 to 2. The link is not clickable right now. At the time of the meeting, they were having a little bit of trouble getting it to work. So shortly, you should be getting an email, or at least the providers for employment programs and day programs should be getting an email with the link, the new link that they would like traffic to go to. And the barcode was working at the time of the meeting, so hopefully that is all good. At the time of the meeting, they said they had a little over 10 businesses that are participating, us included. So hopefully it will be a good event for the community and for our clients.
Is there an opportunity, if someone still wanted to participate in that they could reach out to the Business Advisory Council and say, hey, we want to be number 11?
Yeah, absolutely.
Cool.
Just go to the, they said that hopefully this link will be working soon, so you should be able to just copy, paste it, and drop it in and register. You do have to register beforehand. If not, I would just email Steve, I forget his last name, oh no.
Reuter?
Yes, that is him who heads up the council.
A number of staff here know who that is, but why don't we do this is, Gary, let's make sure we get that, if we can get the updated link, maybe like Monday or Tuesday. And then I would assume that there's probably enough folks that are our service providers that they would appreciate getting an email, so we can have Herman send this out widely to our group. I know it got sent out to our client services managers with the hopes that we could get this going out to our service coordinators as well. So that's good. And then I think I've got one more for you guys, which is this one. Yeah. We've got, and I'll drop this URL into the chat, but there is a person-centered decision-making in healthcare and end of life. And it is on February 26th or 22nd. I don't know, probably the exact same time as something else going on. And it looks like it's Eastern time at 2:30. So what is that, like 10:30 our time, something like that? So I'm going to put that in the chat real quick. And this is, again, a person-centered decision-making webinar. There's no CEUs offered, which makes me believe that it is free, and would encourage folks, if they're interested in learning more about that topic. We have asked for responses from our 875 service providers by February 16th. If you were not contacted directly by Marty or ourselves. Oh, okay. All right, let's see. I'm just going to chat real quick. So we have the copy of the letter right there that Eric has on his SharePoint that he's dropped in there for those that might be interested in the letter that he shared the screen for. And then we have asked for responses from our 875 transportation providers by February 16th. And Kelsey, is that in relation to the rate study questions that might exist?
Correct. Yeah, we sent out emails to all of the 875 transportation providers on Wednesday the 9th, requesting information that we needed. So all of that has been sent out. If there's an 875 vendor that hasn't been contacted, they weren't on the rate study, and we don't need any information from them at this time.
Excellent. All right, well, that is a full amount of updates. Next week, we are going to be having a FMS SDP discussion. Is that right? I see Jennifer nodding her head, and welcome, Jennifer, one of our Associate Client Services Directors. Can you let us know a little bit more about what that's about? I think we're gonna have a flyer going out today.
I sure can. So, hi, everybody. The Self-Determination Advisory Committee has an ad hoc group that has been developing we did some orientations that many of you attended, just general SDP tips for providers. And then we had a little survey that went out. And as a result of that survey, we found that there were two topics that most of you requested more information on. One was the role of the Financial Management Service, AKA the FMS, and another was around independent facilitators and their role. So we decided to use the Coffee with Community Services platform since you're all here already. And next week we will be having our FMS provider little panel to answer questions, provide a little presentation, and provide some context. So looking forward to that.
Yeah, you guys can see the flyer that's going to go out. And do we know who our panel members are?
I don't want to misspeak. I know that I do know, but I don't know at the moment.
Nice. Guess what? Surprise, folks. We're not putting their names out there. So we'll look forward to giving every... No, it's good.
I know Herman was on it. I know he CC'd me on the email. I saw it and it's not coming to me.
That's all right. So again, we'll be sending that out widely so folks know that we're going to have kind of a special discussion next week's meeting. I hope you all have a fantastic weekend. Thank you so much, Jennifer, for that update. And we will see you all next week. Have a great Super Bowl weekend and great Valentine's Day. And see you soon. Take care, folks.